Hi, I'm Rebecca, and this is my physical assessment video. I'll begin my assessment by gathering the appropriate equipment, which you can see I have right here. I will make sure that we have adequate lighting. I will wash my hands and make sure that we have privacy for the patient, which we do have a private setting. So as I approach the patient, I'm going to assess his general appearance. I'm going to look at his clothing, make sure that it's appropriate for the season, that he's clean, well kept. I'm going to also look for any obvious physical deformities, and as he walked in, I was looking at his mobility, at his gait, making sure that there weren't any abnormal movements or motions. I can also assess his range of motion that way. And I'm also going to look at your skin color throughout the assessment, but I can also look right now at your hands and your nails. I'm looking at posture, position. He has very good posture. Mood, affect, those are all things that I will gather more throughout the assessment. And his speech and his ability to hear voice tones will also be gathered throughout the assessment. I'm also assessing his nutritional status, making sure that he is well nourished. So we will begin with the head and the face, and the first thing that we're looking for is eye contact and level of consciousness. Can you tell me your name and date of birth?
Ryan Martin, September 17th, 1990.
Okay, so I had him change his name and date of birth for the confidentiality of this video. Can you also tell me what day it is?
Wednesday.
And where are we?
The hospital.
So I can say he's awake, alert, oriented ×4. I'm going to inspect his face for symmetry. I can also lean forward from him, inspect his hair and his scalp. And his cranium, as I'm feeling for any lumps, bumps. Can assess your temporal artery. There, your sinuses. Any pain or tenderness as I push here?
No.
Right here?
No.
Okay. And have you my hands on your jaw, open your mouth and close. The temporal mandibular joint right there that I was assessing. And I'm going to move on to your eyes. So I'm going to put my hands on your side and tell me when you can see my fingers wiggling.
Right here. No. Right here.
Okay, so that was your peripheral vision. I'm going to use my light to look at your eyes here, bright light. Shine the bright light again here 2 times. So as I'm looking at this, I'm assessing the sclera, the iris, that was specifically the pupillary response. I'm also going to have you look at my pin light and then look back at the wall behind me and look back at my pin light. You can assess for accommodation that way. Other things, cornea. I can look at your conjunctiva. Open up your eyes. And just pull down. Perfect. Next, I'm going to have you turn your head so I can look at your ear. Look at the external ear for any drainage, swelling. I'm going to use my otoscope to inspect the inner ear. Look at the canal, the tympanic membrane that way. And then I'm going to perform the whisper test. I'm gonna cover your ear. I'm gonna whisper a word. Tell me what word you hear.
Baseball. Apple.
That's how we do that. Okay, so now the nose. I'm looking also, again, for symmetry, any lesions, drainage, swelling. Can look. Turn it back away from me. Assess the membranes there. And we'll move to the mouth. I'm going to inspect his lips and then also open up your mouth. Use my right here. Teeth, gums, lift up your tongue. And say, ah. I can look at his tonsils. I would grade his tonsils out of 0, and then also looking at his uvula as we do that. And have you stick out your tongue for me. Perfect. Gonna move down to the neck. So the neck, I'm visualizing, looking for symmetry, the position of the trachea, looking for any jugular vein distension or masses. I'm gonna palpate your lymph nodes. So there we go. And I can feel for your carotid pulse. I'm gonna feel your trachea, your thyroid. Have you swallow for me? Perfect. And then range of motion for your neck, so look to one side, look to the other, tilt your head back, put your head forward, perfect. And then just muscle strength, tilt your neck against a little pressure here, again, push against pressure, good. So now we're moving on to your chest. So I'm inspecting his chest. I can calculate his breathing rate, his effort from this. I'm just going to palpate your chest, touch your chest, and you tell me if you have any tenderness. Tenderness? Good. So now I'm going to have you, each time I move my hand, I want you to say 99. Okay?
99. 99, 99, 99, 99, 99.
There we go. And now I'm going to listen to your breath sounds. So each time I move my stethoscope, just take a deep breath for me. Okay, so now I'm going to move to your back to listen to your breath sounds. First, I need you to turn a little, turn in the chair for me. Probably actually the other direction. It's my bad. I'm just going to put my hands here. I want you to take a deep breath. Again for me. Okay. I'm going to, how do you say 99?
99, 99, 99, 99, 99, 99,
Everybody take some deep breaths for me. Okay, now we're gonna do what's called the whispered, what's it called? It's a whisper test where you whisper 99 as I listen, okay?
99. 99.
Okay, now I want you to do the same thing but say 99 out loud.
99. 99. 99. 99. 99. 99.
Okay? And then I'm going to have you make the sound E as I listen.
E.
Good. And now I'm going to, you can turn back around to the front here. Last thing I'm going to do is just listen to your heart. So just breathe normal. And here at the mitral valve, I can listen to the apical pulse for 60 seconds. The valves, the aortic, the pulmonic, tricuspid, and mitral. And then I'm going to have you just lean forward slightly for me. Okay, that's all. Thank you.
Thank you.